Cape Town, South Africa, the 5th of July, 2012. The activists of the People's Health Movement are finalizing the preparation of the third People's Health Assembly. Some 800 academics, health activists, medical doctors, and nurses from over 90 countries are expected here at the University of the Western Cape. The People's Health Movement, also known as PHM, is a global network bringing together grassroots health activists, civil society organizations, and academic institutions from around the world. It was created in 2000 as a response to the failure of the Alma Ata Declaration to be achieved. PHM works towards the revitalization of primary health care, as well as to address the social determinants of health. In particular, the growing inequity within and between nations, mostly due to unfair economic structures.
Primary objective of People's Health Movement is to democratize health decision making so that the needs of the majority are taken note of and responded to.
The Charter for Health, endorsed by the participants of the first People's Health Assembly in Sabah, Bangladesh, in 2000, constitutes the core principles, vision, and mission of PHM. The Charter defines health as a social, economic, and political issue and emphasizes health as a fundamental right. Health for all means that powerful interests have to be challenged, that neoliberal globalization has to be opposed, and that political and economic priorities have to be drastically changed.
People's Charter for Health is the most significant document on health to come after the Alma Ata Declaration of 1978. But this is much more people-based, people-oriented, people-focused.
The third People's Health Assembly is starting on the 6th of July.
Nous sommes là pour le PHM, pour l'Assemblée. Oui. Et nous voulons ressortir d'ici avec le maximum d'informations concernant les droits de la santé.
Également sortir avec un maximum d'expérience pour pouvoir au niveau du pays agir pour que la santé pour tous soit une réalité.
To learn from each other's experiences and see how also the different ways of how people's health movement can be built in different countries. That this is an important contribution that people can do here beside the official, let's say, content program.
Definitely, actually, it will give us a direction, first of all, and we will be able to discuss like the current situation, the political situation, and the economic situation. So this will be able to guide us and able to motivate us to work in a better way.
My expectation at the end of the whole program should be able to push most countries to make primary health care accessible to more, especially the grassroots people.
First of all, it's going to be an exciting forum for discussing a whole range of issues to do with health. Secondly, I've come to be re-energized, to be with people that I like and respect, to recharge my batteries so that I can continue in the struggle for health and a fair and more just world. And thirdly, because Cape Town is such a beautiful city.
Health activists from across the globe are entering the main hall of the university for the opening plenary session. The plenary session is being opened by David Sanders, who is the chair of the People's Health Movement South Africa, as well as being the convener of the PHA3.
Well, it's wonderful to receive people from all over the world. There's obviously a very diverse representation here. We, from our registrations, We think that there are people from 90 countries or more.
Aaron Motsoaledi, the National Minister of Health of South Africa, is among the guests of honor.
I'm very glad to know and notice that the People's Health Movement has been formed, among others, to rediscover Al-Mahadi.
I have both a local and an international perspective. So we've used this assembly as a way to both revitalize South African health civil society and also to get the policymakers to hear us. So the minister was here today and he was forced to hear us. And I think he made his speech in light of what we're about. And then globally, we're trying also to revitalize the movement. You know, when we started off, it was very spontaneous. We had a tiny secretariat of one part-time person in Bangladesh. Now we have a secretariat which produces Global Health Watch, which orchestrates a right to health campaign in many countries, which organizes international people's health universities, which watches WHO in a very organized way. We've developed a lot in 12 years, but we need to develop more.
The first days of the People's Health Assembly are dedicated to analyzing the causes of the inequalities in the access to health. The plenaries and sub-plenary sessions are focusing on thematics such as global and economic context of health, trade and health, health and human rights, migration, displacement, and xenophobia.
Problems related to the fact that migrants often occupy the most vulnerable parts of society, and so they are affected in all the social determinants. They have poor housing, they don't have their rights protected, they may not have access to health care, they suffer from discrimination, xenophobia, and racism. So all these affect health. And then they have poor jobs without contract, without protection, and so they are exposed to all sorts of vulnerabilities.
Perhaps people also need to be educated on why we are here as migrants. People don't understand. They just think we have come here to steal their jobs, they are women, and stuff like that. So we need to really mount advocacy around that area.
Health, in relation with its social and physical environment, is also a key issue.
The plenary this morning was on social and physical environments for health. And we were really looking at the ways in which the political, social and physical environment supports or detracts from people's health. I was talking about the need to understand how come we live with such massive inequities. What are the processes that enables the world to put up with those inequities? And then thinking about, well, what kind of alternative world do we want? What kind of economic system do we want? And what kind of structures do we need to stop people becoming so wealthy and exploiting the earth and not sharing goods equitably? So, to sum up, that we need to consume less and share more, basically.
Case studies from various countries are presented to inspire others with the aim to learn from each other's struggles and analyses and to strengthen solidarity between countries.
More than half of the people in West Africa do not have access to improved sanitation, and in this particular context, talking about latrine or other ways of disposing human waste. So regarding health systems, I focused on the issue of human resources for health, and I showed how Africa, the region that has 14% of the global population, has a huge burden of diseases, 25% globally. Yet Africa has got only 1.3% of human resources working in the health sector. Clearly, brain drain is an issue. We know right now America is pushing to have universal health care, which has as one of its core elements strengthening their primary systems. To do that, they are going to need a lot of human resources. There could be long-term plans to train, but the immediate consequences of such a policy could be to look for already trained human resources. And here, Africa and Latin America could be the potential places.
The reasons of the drought. Climate has little percentage to do with it, but I blame it so much on the locals. laxity, for not taking up to themselves to ensure that they have food, to ensure that they reclaim their dry land and put them into use. But it's because of lack of dissemination of information to these people.
The health situation is not easy. The system, all social systems, infrastructures, they went down since the beginning of 90s. After the fall of the Soviet Union, there was a budget deficit, there was hyperinflation, and we have lost a lot of human resources. So it's quite uneasy. And concerning the women's health, I can tell that the maternal mortality rates are still high, and although we target Millennium Development Goals and decrease in the maternal mortality rates and also child mortality rates, these are not easy goals to achieve.
PHM South Africa is hosting a National Health Assembly before the PHA3. It used this opportunity to present its tremendous health problems and suggest action for access to health in South Africa.
South Africa, I think, has two main things that impact on health. The one is our legacy of apartheid, where people were disenfranchised, oppressed and exploited on a racial basis for hundreds of years. And we have inherited the legacy of that inequality and poverty. And the second major issue that's special in South Africa is HIV, which affects a huge percentage of our population and interacts in a negative way on other health aspects within the people, within the communities, and places a huge burden of disease not only on the individuals bearing it, but on the health system itself and on the economic status of the country as a whole.
According to the Statistics South Africa, nearly 12% of South Africans have HIV/AIDS. In 2010, 43% of all deaths among South Africans were HIV/AIDS victims. Several NGOs and academics are fighting to make medicines accessible at an affordable price. Some activists want to stop the stigmatization that people are facing.
I'm wearing this t-shirt because I'm living with HIV, and part of wearing this t-shirt is just to mobilize other people that are afraid to talk about their status and to say, no, we are here as people living with HIV. Can we mobilize ourselves and live openly with HIV?
PHM Palestine, well represented during the PHA3, raises the health issues that they've had to face in their occupied country.
We would think that the Palestinian situation would be less of a hassle these days, but it's actually becoming more of a issue of injustice and inhuman rights, where we find more obstacles on daily basis, whether it's the wall, the apartheid wall that is surrounding every single district, whether it's the flying checkpoints, whether it is segregation of Jerusalem and the Jerusalemites from the rest of the Palestinian territories. Gaza is under siege all the time. We have a severe shortage of drugs all the time. We have inability of patients, specifically cancer patients, terminally ill, who need to be referred outside country to live. They do not receive any permits to go out. We have several other challenges on daily basis where our health system is trying to survive and provide health for Palestinians.
The economic crisis is also affecting Europe in a big way, and it has an impact on health too. PHM Europe is here to share its experiences.
First of all, I want to stress that the policies that are now implemented in Greece are exactly the same policies of the IMF, that the IMF introduced and destroyed Africa and Latin America 20 years ago. In terms of social determinants, we have thousands of people that are getting impoverished in a very short period. And this is driving, first of all, to a lot of psychiatric morbidity. We have the suicide rates are raised very importantly and severely, and all kinds of psychiatric crises, depression and so on. And on the other side, where we have this increased needs of the population for more care and more specialist care, the government is closing down the public sector, closing down hospitals, general practices and so on, and we have a growing, very fastly growing private sector, which is, of course, asking for money. So this is an impasse for the health crisis today in Greece is very important. And we are speaking about a humanistic crisis that is coming on if these policies are not stopped and new measures, new policies are not implemented immediately.
I had a talk about erosion of social security in Europe. So I started with an introduction about how social security started in Europe, actually almost 150 years ago, when the industrialization came into Europe. Workers started organizing and started building up small systems of social security to support their colleagues who became ill or who lost their job. And actually throughout the 20th century, every time, step by step, every time that there was a big social struggle or a general strike, the social security systems have expanded. But we see that since the crisis of the 70s and the neoliberal policies that have dominated European politics, the social security systems are being broken down again.
The last part of the assembly gives space to some positive experiences where health activists decided to take initiatives to make health accessible. They believe that participation of all is necessary. Even children can be a motor for change, as this workshop teaches us.
The main purpose of the workshop today was to show what children can contribute to a new public health program. And we believe unless children are involved as active participants, not only as beneficiaries, we are not going to succeed with anything. And that applies to everything else we want to do, whether it's literacy or food security. Half the country's population should be involved because children constitute almost half the country's population.
I think it's very important and I'm proud of this program. Teach us about the lives, everything. Teach us about how are you growing up when you are a person, how to grow up. They teach us about all that stuff.
In Bangladesh, GK Seva is a pioneer organization in the health field, which has extraordinary achievements. It was created by young Bangladeshi doctors in 1971 at the end of the independence war. The aim was to rebuild the country, particularly its health sector and health system. As the years have gone by, GK's activities have extended to the agricultural development, the education of adults and children, the promotion of women's employment. In 1981, a pharmaceutical factory which produces generics was created, and in 1999, a college of medicine established.
In maternal mortality, we have reduced, infant mortality reduced, and at a very low cost. Another big achievement of Ganushastra Kendra, GK, was that fight against the multinationals. We say drug price is too high. Multinational companies are pushing wrong drugs and very costly drugs, and they are making too much of profit. So by 1982, we could convince the government to have a national drug policy. As a result, what happened? We are one of the 49, one of the least developed countries, but we are one country among the least. We produce 97% of our drug necessity are manufactured in Bangladesh.
At a global level, People's Health Movement has developed several programs to revitalize the Alma Ata ideals, such as the International People's Health University, which was established following the second People's Health Assembly in 2005. It is a roaming short course on the politics of health and an original way to involve young people around the world in its movement. This course has been organized here at the University of the Western Cape just before the Third Health Assembly.
The International People's Health University, IPHU, is specifically targeting young people and to give them what we call as political economy of health. Not medical solutions, but solutions that is based on what is happening in the world today.
For people who are working with communities on the ground, who are concerned about poverty, about inequality, there's a lot of challenge involved in linking the big picture, maybe defined in terms of globalisation, trade relations and transnational corporations, to the local circumstance. And we work through the why questions and also the what questions. What can I do? What can I do at the local level, which is informed by my global analysis? What can I do at the local level which reshapes those global factors? So what can I do in a political sense, and what can I do in terms of my own personal, the way I carry myself? Because a lot of these problems we carry around with us. We're part of the same structures that we're trying to change.
During the last 7 years, about 1,000 young people have taken part in over 20 courses organised around the world.
What we really want them to do is to become activists in their country, to spread the concept of people's voice in handling their own health, people's health in people's hands, which is what ultimately we are talking about.
Another global program of the People's Health Movement is the Global Health Watch, which is an alternative book to the WHO's World Health Report and provides important alternative analysis to the global health situation.
What we do is first we analyze various global processes and tendencies that have an impact on health and healthcare. And then we watch, and so the major section is what's called the watching section, which looks at different institutions like UN agencies, WHO, UNICEF, World Bank, the pharmaceutical industry, the media, and finally we also carry stories of resistance, of change, of movements and what they're trying to do.
Each Global Health Watch is written by around 150 volunteer academics and activists. It's having a growing success and acknowledgement, even at the WHO.
Officially they do not acknowledge it, but in fact it's sold now in the Geneva building of the World Health Organization as well. So we do hope that it contributes to some influence on what the WHO is doing.
During the PHA3, every day, based on the content of the sessions, a group of activists works on a document named Cape Town Call to Action. This call to action will give directions to the People's Health Movement globally and country circles for the coming years.
So we're going to work out what are the key points of action and also develop in more detail what our vision of an alternative world is, and an alternative world that enables people to lead flourishing lives and people to lead healthy lives, and for us to have a sustainable planet.
On the final day, a march is organised. Over 1,000 people fill the streets of Cape Town demanding health for all.
Occupation! Down, down! Free, free! Palestine! Occupation! Down, down! Free, free! Palestine! Occupation! Down, down! Free, free! Palestine! Alerta! Alerta! Alerta!
lucho por la vida en América Latina.
This People's Health Assembly has been very inspiring. I've met people from around the world who has been in the front lines working for the achievement of health for all. And as a young doctor, I think I'm getting a lot of inspiration, of strength from other people to push on, to keep on doing this. Yeah.
Coming from a far-off place, Pakistan, which is almost thousands of miles away, we have gathered here to put up this demand, show our solidarity with the PHA South Africa as well as the other 70 other countries.
A demand for the people who have underprivileged and those who are suffering from wrong policies of the world. So we are all together showing this solidarity, the cohesion, the all togetherness here, and this is a very great feeling for us.
The march ends in front of the Parliament. An officer is coming towards the organisers.
Fewer and fewer rich people are controlling the world's resources and the world's health system. And we're saying we're not prepared to accept that, and we represent grassroots movements, research and academic institutions, many policymakers. We even have some people in WHO who support us. And we know that the minister supports these struggles because he's an activist. And I suppose we're ultimately asking the South African government to use its weight in various fora to put forward these kinds of views, because we know that in South Africa as well, we have a health crisis, which is occupying the minister and all of us who work here, and that is part of a global crisis. So thank you very much for accepting that.
No problem.
Thank you.
Thank you.
Thank you very much. Thank you.
Thank you. Sorry.
After 6 days of discussions, analysis, celebrations, strategizing for action, dozens of plenaries, sub-plenaries and workshops, the third People's Health Assembly comes to an end. The Cape Town call to action will inspire the PHM in the coming years. The main objectives will be to build new PHM country circles, to strengthen and to re-energize the existing ones, to create and communicate alternative visions, analysis, discourses and evidence, to actively support and facilitate a range of campaigns for health for all.
We know that the goal of health for all has been taken off the agenda of the people that run the world. And it is really our job to make sure that it is never off the agenda, that we continue to push for publicly financed healthcare systems that don't just give people access to healthcare, but give people access to good healthcare and are integrated into a system that addresses the social determinants of health. Health is far more than going to the doctor and getting pills. It involves where people live, what they eat, what kind of education they receive, and respect for their basic human rights. And when I say that, I'm not really saying anything radical. Anyone has to read the preamble to the WHO to see the vision of health that's presented there.
Je pense que l'Assemblée populaire de la santé est la meilleure chose qu'il puisse arriver au monde de la lutte pour les droits. C'est le type d'événement qu'il faudrait pouvoir multiplier, intensifier un peu partout dans le monde pour qu'on puisse faire entendre, pour qu'on puisse faire comprendre aux gouverneurs et aux décideurs qu'il y a des choses qu'ils ne voient pas, qu'il y a des choses qu'ils devraient voir, qu'il y a des choses qu'ils devraient faire et qu'ils puissent enfin pouvoir prendre leurs responsabilités.
One thing good, lots more people are involved, but I get this made, more and more theoretical papers, we are reading it. We have to talk about more practical, pragmatic way, how we can, revolution doesn't come automatically. You have to work hard. We'll win, we shall win, but time, it will be a question of time.
I guess the thing that I taking home is the strength of such wonderful people that is doing so beautiful things for taking care of life, no matter how hard the conditions are they are living. I guess the love we have for life goes beyond any assembly, any structure or whatever. But what I take from here is the ties, the relationship types, heart to heart, that strengthened our lives, so we can go together. Otherwise, it's not going to be possible. We are together.
For the coming years, the People's Health Movement will try to promote the vision that it has outlined in its charter. Equity, ecologically sustainable development, and peace are at the heart of our vision of a better world. A world in which a healthy life for all is a reality. A world that respects, appreciates, and celebrates all life and diversity. A world that enables the flowering of people's talents and abilities to enrich each other. A world in which people's voices guide the decisions that shape our lives.